got a question. As a registered nurse for 17, maybe 18 years now, I'd have to do the math. I've never been in a situation in my life, as I'm sure most of you nurses, medical professionals have, to where we went through the bullshit that we did with this pandemic. I was travel nursing at the time. Different states, Florida, Tennessee, Arkansas, Louisiana, all over the place. Out of numerous facilities that I was employed at over the course of that period, there was a lot of like-minded people like me who had issues. Mainly issues with what we were giving the patients for treatment. Each hospital had to go by a certain protocol for treatment. That usually involved nasal cannula oxygen, simple mask, then it would progress upward for the oxygen demands that were needed by the patient, right? So then it would go on to, CPAP. CPAP wasn't doing good enough, wasn't oxygenating the lungs, wasn't oxygenating the blood. So our O2 sats were still staying in the dirt, right? During all of that, they were still starting their protocols. They were doing remdesivir. They were putting the patients into a situation where they already were not perfusing, and then you were causing a chain reaction with the remdesivir as it shuts down the kidneys. All of my medical people will understand what I'm saying. Some of you may have to look up some of these terms and go see what it actually does. Within maybe 2 days, 3 tops of starting the protocol with remdesivir, these patients' lab values would start going to shit really quickly. Their kidney functions bottoming out. They would start going into kidney failure. What happens when you go into kidney failure? Your kidneys are a direct reflection of cardiac output. So if your cardiac output goes to shit, your kidneys go to shit. When you have something that's involving the kidneys that is completely shutting down kidney function, like remdesivir, then you automatically slow down the cardiac output. It works both ways on the system, right? So these patients would come to me in ICU, and they had already started their remdesivir protocol on the unit they were sent to first because of their oxygen needs, their medical care level, all of that, right? By the time the patients got to me, we were needing a full-blown CPAP machine, BiPAP machine in some cases. Some situations where patients were coming to us and they had to tube them on the floor and bring them to ICU. By the time we got them, the majority of them were already in renal failure, requiring us to make some split-second decisions and requiring us to put these patients on dialysis. If anybody knows what renal failure looks like, the body starts to swell. It can't get rid of the excess fluid that it has going on. These patients were already struggling to breathe, okay? They're already requiring the max amount of oxygen we can give to them. So once you initiate the process of having to start dialysis, we're at a point to where this is touch and go very, very quickly. I started TikTok when this whole pandemic was starting to kick off. I knew something wasn't right. I knew we were getting lied to. I don't know how else to put it. As a nurse, you go to school, you learn all of these things, you go through the whole nursing program, and you are taught all of the systems and how they progress and what happens to the body. However, I feel like we were living in a dystopian reality because I could literally, and I did, on a daily basis go to the interns, go to the ICU guys and be like, look, this is bothering me. Something's going on. We're given these treatments and the protocol's not working, and my patient is steadily declining and their oxygen needs are totally increasing, and now I can't get their SATs above 80. No one wanted to discuss trying to do things differently. This is our protocol. This is the protocol we were given. This is how we're treating all of these patients the exact same. My specific contract was in Arkansas. I'm not going to name the hospital. However, I had to body bag about 28 patients in that unit during the 13-week contract that I was there. I'm sorry, but that will fuck you up, okay? As a human, as a nurse, you feel like you have let down not only the patient, but the patient's family. I hear a lot of talk online about dancing nurses. I was never at a facility where we were dancing, ever. Maybe that happened other places. Yes, I've seen the videos. Maybe that was an area to where they didn't have as many patients that were considered COVID positive, okay? I'm gonna end this video by saying, I haven't spoken out on this because obviously I've not been able to. Because anytime you try to make a video or you try to talk about the issues that we had going on, or anytime you try to contradict the narrative on what they actually wanted us to believe and all of their bullshit, this is probably my 40-something account on this app right here, on this app, because anybody who was coming forward to try to talk to people, to try to get some type of understanding, to try to get a conversation going, we were shut down immediately. We weren't allowed to have discussions about it. That's how you know it was a psyop, okay? That's how you know. You get discernment and you know that it was a psyop. My whole mission when I started this was to try to wake people up, to try to make people understand, to try to question the narrative, to try to look at things, decipher, read some of the studies that were coming out. We had ivermectin and hydroxychloroquine that was doing wonders for patients outpatient before they even had to go to the hospital in the first place. Okay, that was the main thing. You treat it early, you start to have symptoms just like the flu, and then you treat it early, right? No, you couldn't even talk about that because that wasn't allowed. It's horse paste. You can't say that. You can't say that there's other treatments other than the narrative. Sorry for the long rant. I've been on this mission for years now, and I am so fucking aggravated, and I am so fucking ready for even just a little bit of accountability that needs to come to these people, because they put us through fucking hell, and somebody needs to be held accountable. There's a lot of bodies that need to be held accountable in this.